Yanping Kwang, MD, introduces a study on letrozole use in frozen embryo transfer, FET cycles for women with polycystic ovary syndrome, PCOS. The objective is to compare live birth rates, LBR, in letrozole-stimulated versus artificial cycle frozen embryo transfer. Conducted at Shanghai 9th People's Hospital, this research aims to provide insights into optimizing reproductive outcomes for polycystic ovary syndrome patients. A retrospective cohort study analyzed 2,764 polycystic ovary syndrome patients from 2011-2016, comparing letrozole and hormone replacement therapies during frozen embryo transfer. The primary outcome was live birth rate per embryo transfer. This study provides a foundation for understanding the impact of letrozole on reproductive outcomes in polycystic ovary syndrome patients. Letrozole is administered for 5 days, starting on day 3 of menses. Monitoring begins on cycle day 10 with ultrasound and hormone analysis. Human chorionic gonadotropin is triggered based on luteinizing hormone surge and follicle size. This protocol aims to optimize endometrial preparation, potentially enhancing live birth rates in women with polycystic ovary syndrome undergoing frozen embryo transfer. HRT frozen embryo transfer involves administering oral estrogen and progesterone with embryo transfer based on endometrial thickness. If the endometrial thickness is inadequate, the cycle is canceled. This protocol contrasts with letrozole use, which has shown greater endometrial thickness and improved live birth rates, as will be discussed in the following analysis of cycle characteristics and outcomes. Endometrial thickness was significantly greater in the letrozole group, enhancing implantation potential. Embryo survival rates post-thaw were similar between groups. However, after adjusting for confounders, the live birth rate was notably higher in the letrozole group, indicating its effectiveness in improving outcomes for women with polycystic ovary syndrome undergoing frozen embryo transfer. Miscarriage rates were notably lower in the letrozole group, while clinical pregnancy rates showed no significant difference. Adjusted analysis revealed a higher live birth rate with letrozole. These findings suggest letrozole's potential in enhancing reproductive outcomes for women with polycystic ovary syndrome during frozen embryo transfer cycles. Letrozole enhances endometrial receptivity, potentially improving implantation success. It is cost-effective compared to estrogen agents, though additional monitoring may offset savings. Recent studies affirm letrozole's safety in vitro fertilization cycles, showing no increased risk of congenital anomalies. These findings suggest letrozole as a viable alternative for endometrial preparation in frozen embryo transfer cycles for women with polycystic ovary syndrome. Study limitations include its retrospective design and absence of endometrial receptivity assay. However, the study's strengths lie in its large cohort size and consistent laboratory conditions. Future prospective studies are essential to validate these findings and further explore letrozole's role in improving live birth rates during frozen embryo transfer cycles for women with polycystic ovary syndrome. Letrozole use in frozen embryo transfer cycles for women with polycystic ovary syndrome is linked to higher live birth rates and lower miscarriage rates compared to artificial cycles. This suggests letrozole may be a superior alternative. However, prospective randomized trials are essential to confirm these findings.